Lori Doty has been living with allergies most of her life. She is not alone. Allergies are a common condition affecting 1 in 4 people in the United States.
My allergy triggers are trees, grass, mold, pollen, dust, weather change, environmental factors. I have many triggers.
Exposure to multiple allergens can add up, increasing the likelihood of experiencing symptoms. Testing is the only way to detect allergy triggers, and for many years, Lori endured the traditional pinprick skin test, a prolonged and often uncomfortable process. Now, a simple and easy blood test is changing the way allergies are diagnosed and treated. Thermo Scientific's ImmunoCAP is an accurate and convenient diagnostic tool that can identify allergic sensitization and allergy triggers, which can help physicians develop more targeted treatment plans. Dr. Inderpal Randhawa, an assistant professor of medicine at UCLA School of Medicine, explains how ImmunoCAP is changing the landscape.
Blood-based allergy testing, and ImmunoCAP in particular, for the last 10 years has, I'd say, drastically changed how physicians in general evaluate allergies, mainly because it's allowed easy access with a very good test, very highly sensitive test at a simple doctor's visit.
By measuring the amount of IgE antibody or immunoglobulin E in the blood, ImmunoCAP can pinpoint individual triggers, making it easier for patients to take control and better manage symptoms. And according to Randhawa, studies have shown that ImmunoCAP is highly accurate and very reliable.
I really think that one of the benefits of this test is that you are able to take patients who otherwise could not be tested regularly. So even small babies, for example, you can test them easily. Patients who are on drugs like cardiac medicines many times could not be tested. And this test has allowed them a clear pathway to get diagnosed.
It gives you the printout of exactly what you're allergic to the degree that you're allergic to it. And that way I can change my medicines, get new treatment quicker, faster, that helps me get better sooner.
Reducing exposure to 1 or more allergy triggers can help improve quality of life, reduce the frequency and severity of symptoms, and may reduce the need for medication. And that is true for asthma patients as well. The National Institutes of Health guidelines recommend that patients with persistent asthma who use their rescue medicines on a regular basis should be tested to identify underlying triggers.
The reason for it is very clear. Easily, about 60% of pediatric patients with asthma have some allergic disease. And if you get their allergies under control, their asthma is much more easily able to get under control. If you can identify what the particular airborne trigger is or what the airborne trigger is not, ruling that in or out, makes a drastic difference in how you can approach treatment and get them better.
Quality of life has changed for the better because I can exercise outside, I can go to my kids' events, their soccer games, their baseball games, and not worry that I'm going to have a flare-up, an allergy attack that's going to lead to an asthma attack or something worse.